Okay, so one of the most common sporting injuries that you'll ever find is quote unquote rolling your ankle, or also known as an ankle inversion sprain. Everybody's probably had it done. They land playing basketball or running and cutting, and what happens is the foot inverts and you roll your ankle outward. The damage that actually occurs is a ligament called your ATF, also known as your anterior talofibular ligament, sitting right here on the top of the foot. An injury there is very, very common, and it is something that's able to rehab. For the purposes of this video, we'll assume this is an acute injury and it's only happened within the first couple of days. It's a few quick things you're going to be able to do to help decrease inflammation and improve your ankle mobility. So, first thing you can do, sitting back, ankle ABCs. You literally want to draw with your big toe the ABCs. So that would be an A and a B. You work your way all the way to Z. If it's pain-free, you can try it 2 to 3 times a day. Another thing you could do is a seated gastroc stretch. Grabbing, if you don't have something like this at home, you could literally use a leash or a large bath towel. Pulling back onto the foot. Holding for 30 seconds at a time, 3 sessions of it. And you really should want the intensity around a 3 or a 4 out of 10, if not less. So you want to do this within your pain limitations. The final exercise that I suggest you guys do would be a single leg stance. As long as it's tolerable, come up onto one foot and make sure that your foot isn't falling into pronation or out into supination. Try to keep your knee over your toes. And again, everything you do should be within your tolerance. And before you try into these exercises, follow the RICE principle. Rest, ice, compression, elevation, and hopefully you guys will be back on the courts and back on the fields sooner than you could before you had this video. Okay, so thank you guys for tuning in to Core 3 Physical Therapy's videos. If at any point in time you guys are going through some of the treatment progressions that we gave you guys and you feel as though you're not getting better, please go out and see your physician, or feel free to stop in at Core 3 Physical Therapy, because everybody knows each individual is different and everybody's different. So good luck in your recovery, and hopefully we'll see you soon.